Doctor, what a remarkable testimonial to your skill and also to the technology. I want to go back to the beginning and come back to that broadcast report. What led you to become a pioneer practitioner in the field of personalized surgery and patient-specific medical devices?
Well, thank you, Marianne, and good morning to all of you. For me, the adoption of technology really came for two reasons. One was my interest in the technology, but more importantly was really the interest in the growing need to have this technology available to us in the operating room. I have some slides I'm going to pull up that I'm going to walk you through a little bit of what I do and how the technology became important and is becoming more important in my field. As a plastic surgeon, we're often called to the bedside or the operating room to build, restore, renovate the human body. And as a specialty as a whole, we're really drawn to this specialty because of the creativity, the innovation that's involved in plastic surgery. So as a whole field, we really embrace, we're welcoming technology that's going to help us do surgery better, do surgery quicker. If you look at surgical innovation over the last 50 years, there's been a few key points where we've seen advancements. Some have been in the training and the skill sets that we teach our residents. We've used now advanced techniques, and we're incorporating cutting-edge technology. But for the most part, all of those advancements have been focused or circled around the operating room itself. And the way I see the next 20 or 30 years of growth in plastic surgery and surgery as a whole is in the field of surgical planning. And I think Avi made a great point when he started the conversation, which is most people, when they look back at how we plan surgery, are going to be amazed about how primitive a lot of our surgical planning is. This really changes the whole scope of how we plan surgeries. When I approach a patient or a procedure in plastic surgery, I'm really thinking about two different things. I'm thinking about the soft tissue, which for us means the skin, the muscle, the fat, and then the underlying structures, which is the bone. At present, 3D systems and medical modeling has had a tremendous impact on bone reconstruction. And even still, it's been a very strong impact, but relatively small impact to the greater field. I think there's a lot of area for growth in that, and there's also, and I'll talk about this a little bit later, some areas for growth that I see to move into that second category of soft tissue reconstruction. But there's no question this technology is becoming more important and more recognizable in our field. And just this week in our national newsletter, Plastic Surgery News, front page lead article is "The Rise of 3D Printing Stretches the Limits of Plastic Surgery." They interviewed a number of surgeons around the country about this, and if I can steal some of my quotes from the article, I noted that this technology really eliminates surprises, minimizes complications, and improves the precision of surgery.
Could you give us an overview of where you think this is headed in terms of the virtual surgical planning and 3D printing across the medical field?
Sure.
And your own field.
Well, let me take you back first about how I adopted the technology and how it's sort of moved through the different generations of what's possible. The first real advance that made this possible was the CT scanner. And with that, we had the ability to now take CT scans and look at images in 3D. And that's what you're seeing here in this top left slide. Well, then medical modeling enters the picture and gives us the ability to print stereolithographic models of those skulls. So you can imagine now we have a situation where we can all sit in a conference room, look at the skull in any which way direction, and plan our surgeries based on that. We then take that one step further, and we're now able to take those skulls, sterilize them, and use them in the operating room. So you're seeing here a slide of me actually holding a printed skull next to the skull of the patient to use it as a reference in surgery. So that's really the first generation, just printing the existing anatomy of the patient. Well, you take that one step further, and now we're able to actually plan a surgery on the computer through surgical simulation. So we can move the bony structures where we want them to be, and then we can develop guides and jigs that will help us actually put those bones where we had planned to put them on the computer, and that's really the modeling phase. You then move ahead and you have the ability to print those guides and jigs, sterilize them, and bring them to the operating room to use them during surgery. So I'll show you a few examples of how that has been helpful for us and some colleagues of mine around the country and world. So about 5 years ago, I was the first person to publish a study which showed the use of virtual technology, virtual surgical planning and printing, to take and treat facial fractures. And as an example, what you see here is a gentleman who had a very comminuted, badly fractured lower jaw, and there's multiple pieces there. And surgically, that is a very difficult thing to put back together because your exposure is limited, and you have no reference points as to where to put those various pieces of bone. So I'll take you through another example. This is a gentleman who suffered a motor vehicle accident, and what you're seeing here is a CAT scan, and each of those different colors represents another segment of bone. So you're seeing the various pieces, and I'd mentioned surgically, where your exposure is limited, you have minimal access incisions, putting those pieces of bone back together is a very difficult thing, particularly when you don't have good reference points. So first you have the ability to sit on the computer and put those pieces together. Well, now you move to that next step, which I just showed you, which is to model different types of jigs and guides that we can take to the operating room to actually achieve what we did virtually. Doing it on the computer is one thing, but ultimately you have to translate that from the computer to the operating room. So this is an example of some jigs that I created with medical modeling engineers that we could then take to the operating room. And here we are in the operating room, the 3D printed models, the 3D printed jigs, which you're seeing here in white, being placed on the patient in the operating room and being used to put those various bony segments back together. And then lastly, looking at a CAT scan of how we eventually put those facial fractures back together with the plates and screws and achieving what we'd ultimately set out to do surgically.
So, Doctor, let's go back to that very powerful case of Jayla. Curious about the challenges that you faced there and the solutions that you came up with.
Yeah, Jayla is a great case, and she's really only one of the many uses that I've been using this technology for, but Jayla is a great example of how this technology was so useful, because I don't think this surgery would have been possible, or at least as successful, without having this technology at my disposal. And so Dr. Gupta in his piece showed a very nice demonstration of how we use the technology. In Jayla's case, he showed this image, and the goal here is to take the lower jaw, put this device on, and slowly start to lengthen the jaw. And this is not a cosmetic procedure. In Jayla's case, the reason we needed to do that was she was born with such a small jaw that she had a difficult time breathing. And so this is a picture of her in the ICU with the breathing tube. In the middle, you're seeing her CAT scan. What I just wanted to point out there was how small her lower jaw is. And the picture to the right with the arrow is showing her tongue. And her tongue is so far back that she's really not moving any air. And without lengthening her jaw, she's not going to be able to breathe. So here, what I'm showing is how virtual surgery really was helpful to me. And so in the upper left corner is me sitting at the computer actually on a plane trip, coming back from a meeting where I was talking about this technology and showing how we use this device or this virtual planning to plan our operation. And I just highlighted 4 steps here of how this was so useful for me in the operating room. The first was simply just a device size. I do this operation fairly commonly in adults or children of a larger size. In Jayla's case, she was a few weeks old, so I wasn't even sure if the device was small enough that it would fit onto her lower jaw. So the first step was simply just being able to tell if that device would sit on the lower jaw and be of appropriate size. The second was that her bone was so underdeveloped that I needed to place those devices exactly in the same plane, at the same parallel vector. And that's a very important thing surgically. Up until now, most surgeons do that essentially as a best guess on the operating room table. With this technology and the computer technology, you can put those exactly in the same parallel plane. The other, as Dr. Gupta pointed out, was critical structure. The lower jaw is not just simply made of bone. It has tooth buds that she's ultimately going to need. It has a nerve that supplies sensation to the lip. So using the computer, we're able to now identify those structures and make sure that we're staying away from those critical structures when we're putting the plates on. And then lastly, bone width. With this technology, rather than guessing or predicting the size of the screw that I actually should place, I know the exact depth of that bone and where they should be placed. So for me, this was really critical. Here she is. You're seeing her jaw before we operated on her, and 10 months later, and I just want to point out how much more forward her lower jaw is. But more importantly than her CAT scan is the patient itself. And here she is beforehand with that breathing tube, in the interim with that device on, and ultimately with the device off and breathing without any difficulty.
This is speculative, but 5 years ago, what would her position have been? It's my understanding that you have to grow to a certain age, but now this is just revolutionizing this.
Absolutely. And
Yeah.
most centers in the country don't even offer this technique. What they go to is called the tracheostomy, which is the breathing tube through the neck. And that is a very expensive and a very cumbersome thing for families and a very dangerous thing for kids. With this technology, we were able to offer her this procedure and essentially save her that procedure down the road.
So impactful. So, Doctor, where is all this headed, and how does it change your field and other treatment fields? I'm just wondering what you see as the next big advancements out there.
Well, I think there's in a few areas, and I put this slide to help all of you understand where I think that the potential areas of growth are. I think for the first real focus areas should be on making the existing infrastructure, that existing loop, better and faster. And I certainly don't need to tell all of you. I'm sure you could teach me about how these printers are going to become less expensive, the materials are going to become that much better. I think there's an opportunity for the communication of the loop, the back and forth between us and the printing companies to really be real time or essentially cut down. So I think there's a real opportunity there. The other is I think there's a tremendous opportunity for expanding markets. And I've showed you just a few examples, but even still in the overall spectrum of 20 million plastic surgery procedures performed around this country alone, this really represents a very small percentage, and I think this technology will ultimately impact those other areas. Let me just show you two examples of what exactly I mean by this. What I showed here in this slide is an example of how I use this technology to plan a skull reconstruction. And so you're seeing in the left side on the computer my virtual plan, my VSP of this skull reconstruction. Well, now in many operating rooms, you have the ability to get a CAT scan in the operating room itself, and I have the ability to take a patient through the CT scanner and compare how I did surgically to what I had planned virtually. At the moment, there's really no communication between us and a company like Medical Modeling with 3D Systems. So I think there's a real opportunity for real-time communication for companies like 3D Systems to have a role not just in the planning of surgeries, but the communication, the consultation during the operating room itself. And as a last example, and this is really just one of many, but the issue of soft tissue reconstruction. As I'd mentioned, right now the technologies primarily had an impact on bone reconstruction. Most of what we do actually involves reconstruction other than the bone, but the soft tissue. So just as one example, this is a picture of a child who has a cleft lip. That's I think a fairly reasonable result that you can expect surgically. But what you may not appreciate is for 2 months prior to surgery, this child was wearing this device. And this is a molding device. And the way this works is a child sees usually a prosthodontist. They take an intraoral impression that goes into the mouth. And then each week that child is returning to the prosthodontist, and there are adjustments being made to that splint so it begins to mold the tissues into place. Well, this is an example of where 3D technology is perfect. It's adjustments every week, it's materials, it's hours and hours of a prosthodontist time where I think this would be perfect for 3D printing. So for me, I have to say it represents a pretty important part of my practice, but I think it has the potential to impact a lot more. And I really believe I haven't just been an early adopter of this technology. I think there's tremendous potential for growth in this area. And to hear about the news of 3D Systems acquired Medical Modeling, I think is a tremendous opportunity to kind of put some fuel and some momentum behind taking this technology to a new level.
Doctor, thank you so much. Very, very exciting, and you've just really humanized this technology in a very real way. Thank you.
Thank you.